Welcome to Module 3 of Fall Prevention in the Emergency Department. In this module, we will explore validated assessment tools, intervention strategies, and post-fall management protocols to ensure patient safety in emergency settings. By using evidence-based approaches, healthcare providers can identify high-risk patients early and take proactive measures to minimize fall-related harm. Let's get started. In this module, we will focus on assessing fall risks using validated tools and implementing effective interventions to prevent falls. You will learn how to identify high-risk patients and utilize environmental and technological tools for fall prevention. Additionally, we will cover the immediate post-fall interventions needed to ensure patient safety and minimize further complications. Fall prevention refers to systematic strategies to reduce the incidence and impact of falls in healthcare settings through assessment, interventions, and education. Effective fall prevention follows a structured three-step process, ensuring that at-risk patients receive the care and interventions they need. The first step involves fall risk screening and assessment, which helps identify individuals who may be more susceptible to falls. Using validated tools, healthcare providers can evaluate a patient's condition and determine the level of risk. The second step focuses on personalized care planning. Once a patient's fall risk is identified, a tailored approach is developed to address their specific needs. This may involve modifying their environment, adjusting medications, or providing mobility assistance. The final step is the consistent implementation of preventive interventions. This includes universal precautions, such as maintaining safe surroundings, and specific interventions that target individual risk factors. By following this three-step approach, we can proactively reduce the likelihood of falls and ensure better patient safety and care outcomes. Fall prevention is a critical aspect of patient safety, and numerous validated tools have been developed to assess and mitigate fall risks. These assessment tools, such as the Morse Fall Scale, Timed Up and Go or Tug Test, and the Berg Balance Scale, help identify patients at higher risk, allowing for targeted interventions. The existence of multiple tools highlights the significance of fall prevention in healthcare, reinforcing the need for structured assessments and proactive measures to reduce falls and enhance patient outcomes. Among the many fall risk assessment tools available, some are widely used due to their reliability, ease of administration, and suitability for different healthcare settings. The Morse Fall Scale, MFS, the Tug Test, and the 4AT assessment are among the most commonly implemented tools. These validated assessments help identify high-risk patients and guide appropriate interventions, reinforcing the importance of structured screening in fall prevention efforts. The Morse Fall Scale, or MFS, is one of the most widely used tools for assessing a patient's risk of falling. It evaluates 6 key risk factors, each assigned a score, allowing clinicians to categorize patients into low, moderate, or high fall risk groups. By identifying these risks early, healthcare providers can implement targeted interventions to prevent falls and improve patient safety. MFS is widely used because it is simple, quick to administer, and highly effective in identifying patients at risk of falling. Its efficiency makes it ideal for hospital and clinical settings. Validated through numerous studies, MFS is recognized internationally as a reliable fall risk assessment tool. It is commonly implemented in acute care hospitals, long-term care facilities, and outpatient clinics, reinforcing its significance in patient safety efforts. Conducting the MFS is a straightforward process that helps assess a patient's risk of falling. The assessment begins with gathering a history of falls within the past 3 months, followed by checking for any secondary diagnoses. Observing the patient's use of ambulatory aids, identifying the presence of an IV or heparin lock, and assessing their gait and transferring ability are crucial steps in determining mobility limitations. Additionally, evaluating the patient's mental status provides insight into their awareness of limitations. Finally, the total score is calculated, categorizing the patient's fall risk level and guiding appropriate interventions to enhance safety. Once the Morse Fall Scale assessment is completed, the total score categorizes the patient's fall risk into 3 levels. A score between 0 and 24 indicates no significant risk, where basic nursing care is sufficient. A score ranging from 25 to 50 suggests a low fall risk, requiring standard fall prevention measures. If a patient scores 51 or higher, they are considered at high risk and need enhanced fall prevention interventions. By using this scoring system, healthcare providers can implement appropriate measures to minimize fall risks and ensure patient safety. The 4AT or assessment test for cognitive impairment and delirium is a rapid screening tool designed to assess cognitive impairment and delirium, both of which are significant risk factors for falls. This tool evaluates a patient's alertness, cognition, attention, and any acute changes in mental status. Since cognitive decline can increase a patient's risk of falling, early identification through the 4AT helps ensure timely interventions to enhance safety and prevent falls. The 4AT is a widely used tool because it is fast, efficient, and easy to administer. It takes less than 2 minutes to complete and does not require any special training, making it accessible to all healthcare staff. Its effectiveness in hospital settings, including emergency departments, wards, and long-term care facilities, makes it an essential tool for quickly identifying cognitive impairment and delirium, which are key risk factors for falls. To effectively conduct the 4AT assessment, healthcare providers focus on 4 key areas: alertness, memory and orientation, attention, and acute cognitive changes. The first step is evaluating the patient's level of wakefulness, ensuring they are fully alert or identifying signs of drowsiness. Next, the AMT4 test assesses short-term memory and orientation by asking key questions about age, date of birth, the current year, and location. Attention is measured by having the patient list the months of the year in reverse order, gauging their ability to concentrate. Lastly, detecting acute cognitive changes helps identify sudden confusion or delirium, which are strong indicators of fall risk. By systematically assessing these areas, clinicians can quickly identify cognitive impairments and take appropriate fall prevention measures. The 4AT scoring system is designed to quickly assess delirium and cognitive impairment. A score of 0 indicates no suspicion of cognitive impairment or delirium. Scores ranging from 1 to 3 suggest possible cognitive impairment, warranting closer monitoring. If a patient scores 4 or more, there is a high likelihood of delirium, requiring further investigation and intervention. This tool allows for rapid screening, enabling timely management of patients at risk of cognitive decline and falls in the emergency department. Another important assessment tool for evaluating fall risk is the Timed Up and Go, or TUG test. This test is widely used to assess a patient's functional mobility by measuring their ability to stand up, walk a short distance, turn, and sit down safely. By evaluating gait speed, balance, and lower body strength, the TUG test helps identify individuals at higher risk of falls. It is a simple yet effective tool that provides valuable insights into a patient's mobility limitations and the need for further fall prevention interventions. Why is the TUG test widely used? The TUG test is a simple and non-invasive tool that requires only a chair, a stopwatch, and a 3-meter walking space. It provides objective and measurable numerical data, making it an effective way to assess fall risk. Due to its ease of use, the TUG test is widely used across hospitals, rehabilitation centers, and outpatient clinics for fall risk screening. The TUG test is a simple and effective way to assess fall risk by evaluating a patient's gait speed, balance, and lower body strength. Step 1. Setup. Use a standard armchair with armrests and mark a 3-meter walking distance ahead. Ensure the patient is seated properly with feet flat on the floor. Step 2. Instructions. The patient should stand up from the chair without using hands if possible. Walk to the 3-meter mark at a normal pace. Turn around and return to the chair. Sit back down safely. Step 3. Timing. Start the stopwatch when the patient rises. Stop timing when they sit back down. Step 4. Interpretation. Less than or equal to 10 seconds. Normal mobility, low fall risk. 11 to 20 seconds. Moderate fall risk. Greater than 20 seconds. High fall risk, further assessment needed. This quick test helps identify fall risks early, allowing for timely intervention to improve patient safety. After conducting fall risk assessments using validated tools like the Morse Fall Scale, 4AT, and TUG test, the next step is implementing effective interventions to prevent falls. The 5 Fall Intervention Tasks, or 5FIT, is a structured, evidence-based approach designed to minimize fall risks, particularly for high-risk individuals such as elderly or hospitalized patients. These interventions focus on proactive risk management and patient safety, ensuring that patients receive the necessary precautions to reduce their likelihood of falling. The 5FIT is a structured, evidence-based approach to reducing fall-related injuries in hospitals, nursing homes, and home care settings. Its proven effectiveness ensures patient safety, while its standardized approach maintains consistency in care. The 5FIT is widely endorsed by healthcare organizations like WHO, CDC, and the Joint Commission, ensuring regulatory compliance. Its multidisciplinary use makes it applicable for doctors, nurses, therapists, and caregivers, reinforcing teamwork in fall prevention. To prevent falls effectively, the 5FIT provide a structured approach to ensuring patient safety. First, a falls alert system helps identify high-risk patients through visual markers, like a red triangle on their bed chart, a fall risk bracelet, and proper documentation. Next, supervision and assistance ensures high-risk patients receive support when standing, walking, or using the toilet, with regular checks to meet their needs. Adjusting the bed is key. Keeping it at the right height, securing bed rails appropriately, and locking wheels prevent unintended movement and falls. Providing proper aids like canes, walkers, or crutches ensures safer mobility. Educating patients on their use and assessing their ability before movement further reduces risks. Finally, communication is crucial. Patients should be encouraged to ask for help. Families must be informed about fall risks, and shift handovers should include fall prevention details. By following these steps, healthcare providers can create a safer environment, reduce falls, and improve patient care. Now that fall risk assessment and intervention tools have been explored, it's time to look at key intervention steps that help reduce falls in healthcare settings. Universal fall precautions ensure that basic safety measures are in place for all patients, minimizing potential hazards. Environmental modifications, such as proper lighting, clutter-free walkways, and non-slip flooring, create a safer space and reduce the risk of accidental falls. Advancements in technology, including bed alarms and motion sensors, enhance patient monitoring and provide real-time alerts to caregivers. Finally, multidisciplinary collaboration plays a crucial role, with doctors, nurses, physiotherapists, and caregivers working together to implement comprehensive fall prevention strategies, ensuring patient safety remains a top priority. Universal fall precautions focus on environmental safety, patient assistance, and equipment safety to minimize fall risks for all patients. Ensuring a safe environment includes keeping care areas uncluttered, maintaining sturdy handrails, and promptly cleaning spills. Patient assistance involves keeping call buttons and personal items within reach while educating patients on how to use them. Lastly, equipment safety ensures hospital bed breaks, railings, and wheelchairs are properly secured, with beds adjusted appropriately for transfers. Simple, proactive measures like these help maintain a safer patient environment and reduce the likelihood of falls. Environmental modifications play a crucial role in preventing falls by creating a safe and accessible space for patients. Hazard elimination. Maintain adequate lighting in rooms, hallways, and bathrooms to improve visibility. Keep walkways clear of clutter and remove unnecessary obstacles to ensure smooth mobility. Use non-slip mats and flooring to prevent slipping, especially in high-risk areas. Assistive devices. Install grab bars in bathrooms and handrails in hallways to provide stability and support. Ensure proper use of walking aids and wheelchairs, educating patients on their correct usage. By implementing these environmental modifications, patient safety can be significantly enhanced, reducing the risk of falls. Technology plays a vital role in fall prevention by improving patient monitoring and ensuring timely intervention. Bed alarms help detect movement and prevent unassisted attempts to stand, reducing the risk of falls. Pressure-sensitive mats provide real-time alerts when unexpected movement is detected, allowing caregivers to respond quickly. Wearable fall detection devices further enhance safety by notifying caregivers immediately if a patient experiences a fall. Implementing these technological solutions strengthens fall prevention strategies and enhances patient safety. Fall prevention is a shared responsibility that extends beyond doctors. Nurses play a vital role in assessing fall risks and implementing prevention strategies. Physiotherapists focus on improving mobility and balance, helping patients regain strength and confidence. Pharmacists review medications, particularly fall risk increasing drugs, FRIDs, to minimize adverse effects that could lead to falls. Occupational therapists assess environments and recommend modifications to enhance patient safety. Other healthcare professionals, including caregivers and support staff, also contribute by maintaining safe surroundings and reinforcing fall prevention measures. A collaborative approach ensures a well-rounded, effective fall prevention strategy. Patient safety is a priority, and preventing falls requires a proactive and collaborative approach. By understanding risk factors, utilizing assessment tools, and implementing effective interventions, fall-related injuries can be significantly reduced. To ensure a deeper understanding and reinforce key points, a short questionnaire will follow. Your responses will help assess knowledge and improve fall prevention strategies. Thank you for your time and commitment to patient safety.